of the virus has been found here in Harris County. It's the first confirmation of that variant's presence in the state of Texas. It's an important development, and I want to make sure that residents are aware and that folks know what we need to do based on this. We received confirmation today from the Texas Department of State Health Services that variant known as B.1.1.7 is now here. The individual is a male between 30 and 40 years old from Southwest Harris County. He's in isolation right now. His contacts are being traced, and all care is being taken to make sure that he remains in isolation until cleared by our public health officials. This is the key point, is this variant has the potential to throw jet fuel on an already dangerous situation. And the reason for that is something of a turbocharged version of the virus in the sense that it's a lot more contagious. We're just learning about this variant, about this new strain, but what we do know is it's around up to 70% more contagious. I also need to note there's no evidence that on its own it is more lethal. And the sense right now is that it will respond to the current vaccine. But the point is that the more cases of this virus we see, the more people will be hospitalized, the more people will die. So please do not discount this with a strain, especially even more contagious than the one we currently have. Here's what we're doing as Harris County, and I'll let Dr. Inigo cover the Public Health Department's actions. We've been aggressively investigating all the links with this individual and making sure that people who may have been exposed are quarantining. But I don't want to pretend like this is something we can contain. The virus, this strain, has already been identified in other states. It's the first one that's been identified in Texas, but this individual does not report any travel. So for all we know, it's something like the tip of the iceberg. It's the first evidence that it's here, but more likely than not, we can be pretty certain that it has been here. And so right now, what folks need to do is really double down on not having those interactions, those close contacts and gatherings with people that you don't share a household with. We should all assume that this is not actually the first case of someone with this variant of Harris County. It's the first one we know of. Earlier this week, I noted how dire our hospital numbers are. We crossed the governor's threshold of 15% for 7 days. We've not come down from it. And now we're dealing with a dual threat with the high numbers, the possible impact from Christmas and New Year's, and now a triple threat due to the confirmation of this variant. If there's any good news, it's this. First, we are able to protect from this virus with the vaccine, and I know that we have very limited doses in our county right now, but those who have access to the vaccine, who qualify and are able to access it, I can't stress it enough, you should be sure that you get it. And second, that each one of us still has the ability to prevent being infected by this virus. And the way to do that is the same thing we've done. We've flattened the curve before. We have to flatten it again. It might be a bit harder this time because of the type of strain we're now facing. And so please get tested, and please avoid those contacts. Order in, go to an establishment, in and out, but enjoy our green spaces. Try to avoid any kind of gathering. That it's ultimately in our hands, and we need everybody to do their part. I'll repeat very briefly in Spanish, and then we'll hear from Dr. Inigo, and we'll take questions. Quiero tomar un momento para responder a la información que recibimos el día de hoy, que ha llegado una nueva variante del COVID-19 a nuestra región. Es una noticia importante y quiero que todos sepan qué significa para el condado y qué significa para las acciones que deben tomar los residentes. Hoy hemos recibido confirmación del Departamento de Salud del Estado que hay una variación, una nueva cepa del virus aquí en el estado de Texas, y la hemos identificado en el condado Harris. Es un individuo, un hombre de 30 a 40 años quien vive en el suroeste del condado Harris. A presente está en aislamiento, no tiene historial de viaje. Esta persona está estable, este individuo, y los epidemiólogos están trabajando en identificar todos los contactos que este individuo ha tenido. Esta variante tiene la posibilidad, el potencial de encender aún más la situación grave que estamos viendo en cuanto a los números y las hospitalizaciones. Esta variante es más contagiosa que la que existe en este momento en el condado Harris. Es hasta 70% más contagiosa. Es importante saber que hasta donde sabemos por ahora, con las investigaciones científicas que se han hecho alrededor del mundo, no hay evidencia de que esta variante sea más letal ni que no responda a la vacuna. Entonces, hasta ahora se espera que esta variante sí responde a la vacuna. Pero el hecho de que es tan contagiosa, 70% más contagiosa que la variante que existe en este momento, significa que más personas se pueden infectar, entre más personas se infecten, más personas van a ser hospitalizadas y más personas van a morir. Entonces, por favor, tomen esto seriamente. Nuestro Departamento de Salud Pública ha estado trabajando agresivamente para identificar los contactos de este individuo, invitarlos, asegurarse que estén en cuarentena, pero no quiero pretender que es posible aislar este caso. Todos debemos asumir que este no es el primer caso de esta cepa en el condado Harris. Es simplemente la primera instancia que conocemos. Entonces, sabemos los números hospitalarios, hemos ya cruzado el límite que definió el gobernador, esos números siguen creciendo, ahora tenemos esta variante tan contagiosa y por eso le estoy pidiendo yo a la comunidad nuevamente que por favor doblen sus esfuerzos. Tenemos que aplanar esta curva, el reto va a ser más grande dada la variante que existe ahora, es seguro asumir, podemos asumir con seguridad que este es solamente un caso de muchos que ya existen en nuestro condado de esta cepa tan contagiosa. Entonces, por favor, pongan de su parte para evitar esos contactos con personas con quienes no viven hasta donde más sea posible, porque puede ser una situación aún más difícil. Además de que estamos viendo los números tan graves, veremos el impacto de las Navidades y el Año Nuevo y ahora esta nueva variante. Las buenas noticias es que la vacuna aún protege contra el virus. Sé que hay dosis de la vacuna muy limitadas, pero si usted es una de las personas que califica y tiene acceso a la vacuna, por favor, tome la vacuna, recuerde que es eficiente, es segura y lo protegerá contra esta variante. Muchas gracias. Ahora escucharemos de la doctora Oniego. Doctor Oniego.
Thank you so much, Judge. So, as of today, the first known case of the COVID-19 variant B117 has been confirmed not only for Harris County, but also for the state of Texas. Our epidemiology team at Harris County Public Health is working very closely with Department of State Health Services on this case. We're also identifying, isolating, and quarantining individuals that may have been connected with this individual. This is an individual in his 30s and 40s in the southwest quadrant of Harris County. And I think the important thing to point out is that this individual had no travel history, which really underscores the importance of the fact that even though this is a UK variant, there's no travel involved, and that likely points to the fact that it's in our community. And so it's really important for us to understand those prevention measures from a public health standpoint that we continue to talk about. What we know is that viruses like variants and viruses happen all the time, and they can impact how severe or the transmission ability of viruses. And so we do know that with this variant, it is more transmissible. But what we also know is that it's not as severe in terms of causing clinical disease, but it doesn't mean we don't need to not let our guards down. We still have to double down on those prevention efforts of wearing our mask, watching our distance, doing that proper hand hygiene, and limiting those social gatherings. Our team will continue to collaborate with the Department of State Health Services on this case. And I think it's important for us to know that it's really what we're seeing in terms of increases in our cases, in terms of our hospitalization. Our positivity rate is upwards of 16%. Right now is not the time for us to let down our guards. And this information just further underscores the importance of us doing those prevention measures.
Thank you, Dr. Aniulo. Go ahead.
Questions from the pool?
Judge, obviously we crossed that threshold this week that with Governor Abbott's executive order. Are you considering or thinking about any more steps that need to be taken? Because clearly the public's not seeming to get it and do the right thing often enough.
Look, we're watching our trends very closely. We've seen how other counties that have reached this threshold, what kind of trajectory they've followed. El Paso, obviously, they reached the threshold, and from there, they accelerated and reached a catastrophic point. Other areas crossed the threshold, and they managed to flatten the curve. And so even before the threshold was designated back in the summer and in November. So we're watching our trends. I think it's a little early to tell whether we're going to be able to flatten it or whether it's going to continue to accelerate. I want to give the community a few days to see how that changes, and we're constantly investigating what more we can do. The reality of the situation is, as you all know, in many ways my hands are tied. That's why I so welcome this trigger and this slight rollback. But I can't stress enough, it's not about 75% or 50%. That's splitting hairs. It's about the type of behavioral change that we've seen already twice this year that has helped us flatten the curve. And so I can't ask any more strongly of the community to do that, to take it upon their own hands, to avoid those gatherings, to not gather with anybody they don't live with without a mask. We're continuing to explore all options, but I'm not going to pretend like there's one readily available. Even, we've discussed the curfew earlier, and we're now watching that move through the courts, and it's unclear whether or not that's at our disposal anymore. So we have to go straight to the community. I don't want to see more deaths than what we've seen. I don't want to see more hospitalizations than what we've seen. I don't want to see a situation like El Paso. We can avoid it, but the people really need to do their part, and I hope that this strain is another wake-up call. We had one earlier this week. Here's another one. Let's heed that we're hearing these very last warning signs, and so it's incumbent on us to do our part.
Judge, as you know, we've been at the highest COVID threat level for 6 months, and many people have resumed normal lives. Why aren't they listening anymore to the guidelines?
I think everybody recognizes we are all tired. We all wish that this were over, and so I have a hard time blaming it on the community. I do think that there has been a temptation to pretend like things are better than they are. There was a reopening in April, May that came too soon, was too aggressive, and led to June, July, and 1,200 deaths in 1 month. The same thing happened in September, right? The numbers were looking better, but they weren't looking good to reopen to the degree that it was done. And so if the community receives that message that, hey, everything is open, it's easy to assume that things are fine. We didn't change threat levels because we knew that speed and extent of reopening inevitably was going to put us where we are now. So, the best I can do is explain the situation to the community. I get that we are tired. We now have hope in the form of the vaccine. Let's not stress our system to the breaking point. Let's not lead to more deaths and hospitalizations. And I do hope that going forward, as we plan for the next pandemic, as if this goes on for a whole lot longer, there does come a point at which we have to recognize that we're sacrificing both lives and health and the health of the economy when you compare it to countries that did control the virus, that have just but a handful of deaths, have just but a few cases, and their economy is doing better. And so it's, I also just refuse to accept this false dichotomy of health or economy. I think we could have done both We're where we are right now, and right now people need to do their part and just pull a little bit more perseverance, recognizing all of us are in this together, all of us are tired, but all of us are fighters.
If that 15% threshold is too little, too late, what is a better threshold?
The thresholds that I believe we should use and should have used are the ones we helped develop with the Public Health Department, with international and national research, which require progress and continuous progress before you reopen a little bit more. So it's not a matter of getting to the breaking point of where you're about to hit hospital capacity and then taking action. As we've seen in El Paso, it's very easy to miscalculate on that one. So the theory was that if the hospitals hit 15% capacity of COVID patients, then all of a sudden this threshold is going to prevent the hospitals from being overwhelmed. Well, it didn't work over there. And so we don't know if it'll work over here, and that's not a risk that I believe we should take. But really the way to handle this is, and ideally, always, is to contain. That ship sailed back in March and April, and now, the perspective I have and continue to have is it's not about pushing the system to its brink. Number one, because I don't find it morally correct for the lives of people in our community, but number two, because it's very easy to miscalculate and break it, like what happened in El Paso.
Is it a matter of not if, but when we start finding other people with this strain? Because clearly, he got it from somewhere. Somebody got this strain. So is this kind of like the Pandora's box? This reminded me of March with the rodeo. It's like, oh my God. Clearly there's community spread somewhere. So is that kind of the same thing that we're expecting to find these other cases very soon?
Yeah, I think that part of what we know is that this individual didn't travel. And so, and what we know from this strain is that it is more transmissible. And so without a travel history and it being easily transmitted, then we have to assume that it's in our community. And so one of the things that we have to continue to remember is that a significant portion of our community, that not just our community but across the country, can be asymptomatic. And so it's really important for individuals not only to continue to practice those prevention measures that we continue to talk about, but to get tested. And we have access to those testing sites on our website and at the readyharris.org as well. And so I think that's an important message also to keep in mind, is that yes, more than likely, because this individual didn't have travel history, we can assume that it's likely in our community. Like I said, it's not one thing that we know is that because it is transmissible, then that means that there potentially could be more cases.
We've got time for just one last question before it's back in session. So, is there anything else pressing that you all have?
No, I think that's it. Okay.
Yeah.
Thank you very much
Thank you,
for your
good.
time.
Thank you.
Yep. Okay.
Thank you.
Thank you, everyone.
Oh.
Wrapping up comments now from the Harris County Judge Lina Hidalgo and that county's health authority. They're talking about a man in between his 30 and 40s, having the first confirmed case of this UK variant of COVID-19. Again, they are saying that this man had no history of travel, had not gone out of the country or anything like that, and that should send, warning signals, alarm bells to everyone in the community that likely this variant is already out there and being spread. They said the biggest issue with this is that it's more easily transmittable. And when we've seen community spread so high already, this may make things worse and get more people sick. Therefore, they're asking people to do those same protective things that they've been doing all along these past few months. That's social distance. That's wear your mask over your nose and your mouth. That's the correct way to do it. To limit interactions with people you don't live with. Wash your hands. And get tested if you feel sick. And stay home if you also feel unwell at all either. I think that's something that we could all, not just in Harris County, but all across the state, including here in Austin, should be able to share, because we're seeing very high spread at the moment in our area too. For more information about this, you can read about it on our website. That's kxan.com and on the KXAN News app, so please download that if you've not done so already. You can also tune into our upcoming newscasts at 4:35, 6, 9, and 10. Once again, I'm Will Dupree. Everyone, please be safe, be careful out there, and take care.